Welcome, everyone. I want to talk about how effective communication is at the heart of nursing practice. Whether interacting with patients, families, or colleagues, how we convey information can significantly impact outcomes. As nurses, we must be as skilled in communication as we are in clinical tasks. This session will explore the importance of both verbal and nonverbal communication, the role of soft skills, and techniques for resolving conflicts professionally. By mastering these skills, you'll be better equipped to provide compassionate care, foster collaboration within healthcare teams, and navigate challenging situations with confidence. This is Professor Osorio, and now let's dive into how strong communication forms the foundation for excellent nursing care. The key takeaway from this slide is that communication in nursing is just as important as clinical skills. Nurses need to be proficient not only in performing medical tasks, but also in conveying information clearly and empathetically. The quotes from the American Association of Critical Nurses and the Joint Commission highlights the critical role communication plays in ensuring patient safety and the overall effectiveness of healthcare. I want to introduce the concept of soft skills, which refer to interpersonal abilities that are not directly related to job-specific technical tasks. These include social skills, the ability to communicate effectively, and maintaining a positive attitude. The slide emphasizes that these skills are crucial for professional success because they determine how well individuals can connect and work with others. The example provided highlights that while professionals like physicians, nurses, and administrators may all have strong leadership and communication skills, how these skills manifest in practice can vary greatly depending on their roles and responsibilities. In essence, soft skills are as important as technical skills for building effective relationships and thriving in a professional environment. Depending on the situation, you may need to prioritize either hard skills or soft skills, or sometimes strike a balance between the two. For example, when a patient is coding and the room is chaotic, I must be assertive in my communication, confidently assigning tasks to the team and ensuring decisions are carried out. At the same time, I need to professionally ask bystanders to step aside. However, when the situation looks dire and the family is present, I need to shift and show empathy, demonstrating adaptability. Throughout, I must maintain a balance, critically thinking, which is a soft skill, while performing the technical tasks such as administering ACLS, assessing the patient, providing clinical expertise, and documenting everything in the EMR. This diagram illustrates the various factors that influence the interpretation of communication. Interpretation is at the center, and it's affected by elements such as perception, which is how the individual perceives the message based on their personal views, preconceptions, which are existing ideas or biases that might affect how the message is understood, precipitating events, the situation or event triggering the communication, which can shape the response. And context is the broader circumstances or environment in which the communication occurs. Past experiences are previous interactions or experiences that influence how the message is interpreted. And then there is the physical or emotional setting known as the environment, which can impact the clarity and reception of the message. Transmission is how the message is delivered, either verbally or non-verbally, and it affects how it is received. Each of these factors play a role in how communication is understood, making interpretation a dynamic and multifaceted process in nursing healthcare. This chart represents the various factors that shape who you are as an individual, particularly in how you communicate and interact with others. Each of the four outer components contributes to your unique identity and influences how you present yourself and respond to situations. Thoughts, feelings, perceptions, and values are internal factors that guide how you view the world and shape your reactions. Your mindset, emotional state, beliefs, and values influence how you interpret information and communicate with others. Experiences, education, roles, skills, and abilities are the knowledge and talents that you have acquired along with your roles in life, such as being a nurse, a student, or a caregiver. And they all influence how you approach interactions and solve problems. Gender, genetics, culture, upbringing, and your history are factors that play a role in how you perceive and interact with others. They shape your worldview, right? And affect how others perceive you as well. Your personality, voice, presentation, and your style is how you present yourself. Your personality traits, communication style, the tone of your voice, and overall demeanor affects how you come across in conversations and professional settings. The central idea is that you are a combination of all these influences. Together, they define your approach to communication, your interactions with others, and how you navigate various situations in life, particularly in the context of nursing or healthcare setting. Understanding these elements helps you become a more self-aware person. It helps improve your communication and relationship with patients, families, and colleagues. This slide explains the basic elements of communication. The sender is the person who delivers a message. The message is the information being communicated, and the way it is relayed can be verbal, nonverbal, written, or digital. The message is directed toward a receiver, who is the person that interprets and processes the information. The effectiveness of communication depends on how well the message is understood and the impact it has. Communication is a dynamic and cyclic process, meaning the roles of sender and receiver constantly alternate. Once the receiver responds, they become the sender, creating an ongoing exchange of information. This continuous feedback loop ensures the communication flows effectively, with each participant adjusting based on the response received. The most important thing in communication is hearing what isn't said, is a quote by Peter F. Drucker that emphasizes the importance of understanding the unspoken elements of communication. As healthcare professionals, it is crucial to not only listen to what is said, but also to be attuned to the nonverbal cues and the context in which communication occurs. In nursing, even when patients are unable to verbally communicate, whether because they're sedated or unconscious or unable to speak, it is important to continue speaking to them as the presence and verbal connection can have a calming effect. For example, in my practice, when I recover a fresh open heart patient, I continue to talk to them throughout the process, even if they are sedated. I introduce myself, explain their transfer to the ICU, and orient them to their new surroundings. I find that this helps the patient wake up with less confusion and contributes to the smoother recovery outcomes. Maybe it's just me, but I apply this same approach with patients who are on ECMO or even during postmortem care. Communicating through every step helps maintain human connection, even when verbal responses are not possible, reinforcing the idea that care extends beyond what is said. Now, let's shift our focus on the importance of verbal communication and the various factors that influence its meaning. The spoken word can carry multiple interpretations based on how it is delivered. Factors like tone, inflection, and emphasis on certain words can alter the intended message. Additionally, the attitude accompanying a verbal interaction plays a significant role, often conveying more than the words themselves. It involves a tendency or predisposition to respond in a certain way, which can deeply affect the quality of communication. As a healthcare provider, it's important to be mindful of your attitude, especially when tired or stressed. Patients not only deserve the best of our technical skills and critical thinking, but also our best attitude, as it significantly impacts their experience and care. I want to emphasize the role of nonverbal communication in reinforcing or contradicting spoken words. Key factors such as facial expressions, eye contact, posture, and body movements are critical in conveying messages. Additionally, your dressing style, your lifestyle, and material possessions can indirectly influence communication. Cultural differences, such as interpretation of eye contact, can affect how nonverbal cues are perceived. Adjusting these subtle habits based on cultural sensitivity is crucial for building rapport and trust with patients, enhancing the overall communication experience in healthcare. Positive communication is a cornerstone of patient care, but we all know that maintaining these qualities during a hectic shift can be challenging. However, building a strong foundation of these skills will help them become second nature to you, integrated into your daily nursing practice. Think about the golden rule. How would you want to be treated if you were the patient? Would you prefer a nurse who keeps their word, follows up on your concerns, and shows empathy? Or would you feel comfortable with a nurse who is dismissive and lacks compassion, like Nurse Ratchet? The truth is, we all have bad days, but making a conscious effort to uphold positive communication will not only improve patient outcomes, but also strengthen the nurse-patient relationship. So, let's dive deeper into these techniques and see how we can consistently apply them in our practice. Using open-ended questions is essential for nurses because it encourages patients to share more information, fostering better understanding and communication. Here's an example of a nurse-patient interaction using an open-ended question. For example, the nurse says, I notice you've been feeling a bit down today. Can you tell me more about how you're feeling right now? In this example, the nurse avoids a simple yes or no question and instead invites the patient to elaborate on their emotions. This allows the patient to express themselves more fully, providing the nurse with valuable insights into the patient's emotional or physical condition. Feedback in communication ensures that the message is understood correctly. The sender should ask for feedback to confirm that the receiver has interpreted the message as intended. Similarly, the receiver should stop the sender if the message is unclear and provide regular feedback to avoid misunderstandings. Example of useful feedback phrases include what I hear you saying is, or I understand you to mean. This process helps create a clear and effective communication loop between both parties. This slide emphasizes that body language plays a crucial role in communication. An open stance, like keeping arms at your sides or extended toward the patient, along with leaning in to show attentiveness, helps enrich interactions. Crossing arms, even if it's just out of habit or because you're cold, can unintentionally send a message of being closed off or disinterested. Being mindful of these nonverbal cues can enhance rapport and create a more supportive environment for patients. Let's discuss the importance of personal space and sensitivity to touch in patient care. Nurses should be mindful of each patient's comfort level with touch. as a gentle touch can convey genuine concern and support. Or if they're uncomfortable, it might just make them even more uncomfortable. For example, when a patient is feeling anxious, asking for permission to hold their hand or softly placing your palm on theirs can help de escalate the situation. In my practice, this approach often prevents more aggressive measures, like restraining a patient, which can be traumatizing to them. While there are situations where touch might not be appropriate, being sensitive to its power can help build trust and calm patients effectively. Negative communication techniques can hinder effective interactions. Blocking means dismissing or blowing someone off when they try to express concerns, which can lead to feelings of being unheard or unimportant. Providing false reassurance means giving empty reassurances like "don't worry, it will be okay," which can come across as dismissive and make patients feel their concerns are not being taken seriously. Avoid conflicting messages as well, because it is sending mixed signals, such as smiling while being uninterested, which can create confusion and mistrust. Being mindful of these negative behaviors is crucial for fostering a supportive and trusting environment with patients. Logical fallacies are arguments based on flawed reasoning. The types of logical fallacies are ad hominem abusive. For example, you say, you can't trust her opinion on patient care because she's always so emotional. This attacks the person's character rather than addressing the actual argument or concern. Another type of logical fallacy is an appeal to emotion. An example of this would be you say, you should keep this patient on life support. Think about how heartbroken their family will be. This relies on an emotional plea rather than discussing the medical facts or patient's wishes. Another type of logical fallacy is red herring. Here, you can say something like, we should discuss the patient's treatment plan. And then someone responds, well, I'm from New York and we handle things differently here. This response introduces an irrelevant topic to divert attention from the main issue. These fallacies can undermine productive communication, so it's important to recognize and address them when they occur. Distractions can hinder effective listening. Preparing a response before the speaker has finished can cause you to miss important details. Noisy surroundings or other disruptions can make it hard to focus on what's being communicated as well. Personal worries or stress can block your ability to fully absorb and engage with the conversation. Trying to multitask during a conversation, guilty, can lead to divided attention and incomplete understanding. This is where I fall short often, because the life of a nurse is a series of distractions and multitasking. With enough practice, you will find a way to balance both, though. Likewise, peculiar mannerisms or lack of active engagement can signal disinterest and disrupt the listening process. Being aware of these distractions can help improve listening skills and foster better communication. Good listening habits can enhance communication with patients. You want to focus completely on the person speaking and avoid distractions. Rephrase what the sender has said in your own words to confirm understanding. You want to face the speaker and maintain eye contact to show attentiveness and respect. Be aware of body language and other nonverbal cues to provide additional context. Avoid interrupting. Listen fully before formulating your response. Active listening is key to ensuring the correct message is received and can significantly improve patient care and communication. Absolute accuracy is important when recording in medical records, as they are legal documents. Reports should be thorough, concise, and truthful, With patients and their representatives now having access to their charts, it's even more critical to ensure integrity in charting. Regardless of access, nurses must document facts only, maintaining professionalism and trust in patient care. Computer-based communication include email, text messages, attachments, and chat rooms. While these methods are convenient, they lack nonverbal cues, which can make interpreting the intended message more challenging. It's also crucial to be aware that digital communication can often be retrieved even after it has been deleted, so caution is needed. To avoid misunderstandings, always seek clarification to ensure that the correct message is conveyed and received. I have to be mindful when using Epic Chat as I tend to overly be enthusiastic in my communication with peers, often using a lot of emojis and exclamation marks. Depending on the doctors I'm interacting with, this approach could be perceived as bossy or annoying. Here are examples of the four communication styles commonly found in nursing. First is an assertive communication style. An example would be when you say, I understand that you have a lot of concerns about your patient's care. Let's discuss your priorities so we can work together to address them. This approach is direct, it's respectful, and collaborative, and acknowledges both parties' perspectives. Should you choose to be aggressive, you could say something like, I need you to stop interrupting me and listen. This is how we're going to do things, no questions asked. Now, unfortunately, this style is confrontational, often disregarding the other person's feelings or input, which can lead to conflict, right? Or you could be a passive communicator. An example would be if you would say, it's okay if you want to change the care plan. I mean, I'm not sure what's best anyway. Passive communication is hesitant and non-assertive, often deferring to others even when it's not appropriate or safe to do so. Lastly, you could also be a passive aggressive communicator. An example would be when you say, sure, I'll handle the extra work as usual. This style expresses frustration or dissatisfaction indirectly, using sarcasm or subtle digs, which can create tension and misunderstanding in the team. Depending on my setting and patient population, I often need to find a mix of different communication styles. For example, I have patients who completely refuse to get out of bed on post-operative day one. I start by being assertive in my communication, but that doesn't always work. In these situations, I might become more assertive or even borderline aggressive by reminding them that when they agreed to this surgery, they also agreed to get out of bed for every meal and to start walking on day one, unless there's an absolute contraindication like active or profuse bleeding. I also explained that while the surgery went well, staying in bed can lead to pneumonia and serious complications, including death. There is an art to this approach, though. I make sure to use an assertive tone, not yelling, while holding the patient's hand with their consent, of course, and maintaining eye contact to show empathy and genuine concern for their well-being. I also offer pain medications before getting them out of bed so I can say I've done everything I can to make this as comfortable as possible for you. Now it's your turn to put in the work. Take a minute, pause the video, and answer this question. The correct answer is B, because aggressive communication conveys dominance and limits the focus or understanding of the opinions, values, or beliefs of others. A is incorrect because with strawman, a person's position on a topic is misrepresented, and in this situation, the manager is very clear about her position. C is incorrect because with assertive communication, the sender states his or her basic rights without violating the rights of others. The manager was clearly violating the right of the staff nurse in this situation. D is incorrect because passive communication includes the use of apologetic words with hidden meanings and failure to say what is meant. This slide compares communication styles based on gender differences. Women generally aim to compromise and prioritize preserving relationships. They often communicate with a sensitivity towards how their message is received, valuing the communication process as an essential part of building and maintaining relationships. Men, on the other hand, tend to focus on winning and aggressively work toward achieving specific goals. Their communication style is more purpose driven, using it as a tool to convey information and accomplish an identified objective. These differences highlight how each gender might approach interactions, which can be crucial to consider in teamwork and patient care. Please keep in mind that these are generalizations and may not apply to every situation. It's important to be cautious about categorizing people based on these differences. Many nurses, especially those with extensive experiences, have learned to adopt their communication styles in ways that go beyond gender distinctions. This slide outlines the generational differences in communication styles, reflecting the varying preferences and attitudes shaped by different life experiences and cultural contexts. A traditionalist is someone who was born before 1945. They tend to value face-to-face communication and formal interactions. They respect hierarchy and often prefer structured communication. Baby boomers are born from 1946 to 1964. They appreciate in-person communication, team meetings, and phone calls. They value personal connection and might take a more formal approach. Generation X are people born from 1965 to 1980. They prefer direct, straightforward communication and often use emails or phone calls. They value efficiency and might seek a work-life balance in how they communicate. Millennials, born from 1981 to 1996, often lean towards digital communication, such as texting, social media, or instant messaging. They appreciate quick informal interactions and value feedback. Generation Z, born 1997 and later, highly comfortable with digital and multimedia communication, such as video calls, messaging apps, social media platforms. They prefer visual and interactive communication style. Understanding these generational differences can help tailor communication strategies to be more effective when interacting with diverse age groups in the healthcare environment. Cultural competence is important in nursing. Sensitivity to cultural differences is a crucial part of patient care. Some potential challenges include language barriers, because it makes direct communication difficult if there is a language barrier, and the use of slang or colloquialisms can lead to misunderstanding. Another is stress factors. Patients who are ill or hospitalized may experience heightened stress, increasing the potential for miscommunication. Then there is also cultural variations. Different cultures may interpret common miscommunication components, like direct eye contact, touch, or gestures. What might be seen as friendly in one culture could be considered offensive or inappropriate in another. Nurses are encouraged to continue improving their cultural competence to provide effective care to diverse patient populations. A recent example of a breach in confidentiality in nursing occurred at Yakima Valley Memorial Hospital in Washington. In this case, hospital security guards accessed the medical records of 419 individuals without a job-related reason. The unauthorized access included sensitive patient information such as names, dates of birth, medical record numbers, addresses, treatment notes, and insurance details. The breach resulted in $240,000 settlement and required the hospital to implement measures to enhance its policies and procedures to safeguard patient information, including staff training and prevent similar incidents in the future. You could go to the HIPAA Journal website to look at other incidences. Another incident involved a nurse at a Texas Children's Hospital who was fired for posting protected health information on social media, violating HIPAA regulations. This incident highlights the importance of maintaining patient confidentiality, especially when using digital communication platforms. In a recent incident at a Texas Children's Hospital, a nurse was fired for violating HIPAA after sharing specific details about a pediatric patient on social media. The backstory involved the nurse posting in a private social media group about a young patient who had contracted measles after international travel. She discussed the patient's condition in a way that revealed protected health information without proper consent. Despite the post being in a private group, the details were distinct enough that the patient and hospital could be identified. This breach underscored the danger of discussing sensitive patient information on social media, even in seemingly secure private spaces. As a result, the nurse was terminated from her position at the hospital, highlighting the importance of maintaining confidentiality and adhering to HIPAA regulations on all forms of communication, including social media. Nurses who violate HIPAA face a range of consequences, from internal disciplinary actions by their healthcare organizations to sanctions from the nursing board and even criminal charges. Penalties can include fines, job termination, loss of your nursing license, and in severe cases, legal prosecution with potential jail time. It's simply not worth risking your career and reputation for a moment on social media. You have worked hard for your license, protected by adhering strictly to patient privacy regulations. Remember, the likes and online attention are never worth jeopardizing your professional future. I want to introduce different conflict resolution styles that nurses can use when dealing with disagreements or challenging situations. First is avoidance. In this style, one person uses passive behavior and withdraws from the conflict. As a result, neither person is able to pursue their goals and the conflict remains unresolved. Second is accommodation. Here, one person puts aside their own goals to satisfy the other person's desires. While it can help maintain harmony temporarily, it may lead to resentment if one person consistently sacrifices their needs. Third is force. In this approach, one person achieves their goals at the expense of the other. It involves assertiveness to the point of aggression, which can result in a win-lose situation and potential damage to relationship. Fourth is compromise. This style involves both parties giving up something to achieve a partial goal. It can be effective in finding a middle ground, but it may result in neither party being fully satisfied. Lastly, and more importantly, is collaboration. This is the most constructive approach where both parties actively seek solutions that satisfy everyone involved. It involves open communication, mutual respect, and a problem solving mindset leading to a win win outcome. Understanding and choosing the appropriate conflict resolution style can help nurses navigate difficult situations effectively. Professional responses to conflict that nurses can use to manage challenging situations effectively include moving to a private location. If a conversation is escalating, try to find a more private space to continue the discussion calmly. Speaking in a normal tone by keeping your voice steady and calm and avoiding raising your voice because that can escalate tensions further. Using I messages. You want to focus on expressing your own feelings and needs without blaming the other person. For example, I feel concerned when instead of, well, you always do this. Maintaining eye contact. This conveys attentiveness and respect, helping to build a connection. Be careful though, some cultures, like some of us in the Asian culture, think of eye contact as something sort of an aggressive way of communicating. Maintaining an open body stance. Keep your hands at your sides or open towards the other person. Avoid crossing your arms or backing away unless you feel physically threatened. You also want to avoid excuses because while offering explanations, you want to be careful not to deflect responsibility. And you want to follow through. If you say you will take action, make sure to follow through. This builds trust and shows accountability. Using these strategies can help de-escalate conflict and promote a positive resolution. I encourage you as new nurses to invest in developing these communication skills by evaluating your current tendencies and implementing changes where needed. Doing so will not only benefit your career but also help make your shifts smoother. When patients trust you and know they can rely on you, it eases the experience for both them and their families. I want to thank you for your attention, and as always, please feel free to reach out to me via email, text, or in person if you have any questions. Thank you and have a great rest of your day.